Deeper sleep, better mood. The art of listening to your body through a simple glass of water. Sleep is a vital foundation for both physical and mental health, especially for seniors. After turning 60, many people begin to experience difficulty falling asleep, frequent nighttime awakenings, or feeling tired even after a full night's sleep. According to Harvard Medical School, sleep disorders are among the most common issues in older adults and have a direct impact on immunity, memory, concentration, and daily emotional well-being. There are several reasons why sleep problems occur in the elderly, including age-related changes in hormones and circadian rhythms, chronic stress and underlying anxiety, decline in digestive function causing bloating or nighttime acid reflux, imbalanced body pH levels leading to increased nerve stimulation. In this context, baking soda, a mildly alkaline substance, may help improve sleep quality by balancing the body's internal environment, supporting central nervous system relaxation, and promoting a more natural sleep onset. Preliminary studies suggest that a slightly acidic internal environment may increase the activity of stimulating receptors, making it harder for the brain to relax. Baking soda helps neutralize excess acidity in the blood, reduce unnecessary nerve activation, and supports steadier neurotransmitter activity during rest. Benefits of using baking soda before bed: reduces bloating and acid reflux, common nighttime discomforts. Stabilizes blood pH, helping the nervous system relax more easily. Enhances deep sleep quality and reduces midnight awakenings. Supports gentle regulation of heart rate and blood pressure during rest. Simple usage to support better sleep. Mix 1/4 teaspoon of baking soda into a glass of warm water, 120 milliliters. Drink it 45 minutes to 1 hour before bedtime. Use only 2 to 3 times per week, especially on days when the body feels heavy or restless. Along with baking soda, the following habits should also be incorporated. Take a warm bath or foot soak before bed to promote circulation. Avoid electronic devices for at least 30 minutes before going to bed. Create a quiet, cool, and dark sleeping environment. Listen to soft music, read a paper book, or practice gentle meditation to relax the mind. Medical note: baking soda should not be used as a treatment for chronic insomnia. Avoid use if you have kidney issues, heart disease, or uncontrolled high blood pressure. If you experience unusual symptoms such as headache, nausea, or prolonged insomnia, after use, consult a doctor. Many older adults have shared that just sleeping 1 to 2 hours more deeply each night made a huge difference in their daily energy, mood, and overall joy in life. Baking soda is not a miracle drug, but when used properly, it can serve as a gentle bridge to more natural, worry-free sleep without medication, without stress. Conclusion: a healthy life journey from simple things. As we grow older, what matters is not just living long, but living actively, healthily, and meaningfully. Taking care of health in our golden years doesn't have to be complicated. Sometimes just a warm glass of water with a small spoonful of baking soda, when used wisely, can bring about positive changes for both body and mind. Always listen to your body, stay committed to healthy habits, and remain consistent with the small things that bring long-lasting results. Taking care of your health is not only a responsibility, it's also an act of self-love every single day. If you found this content helpful, don't forget to share it with a loved one or friend who's looking for natural ways to stay healthy. And be sure to subscribe to the Senior Health Table channel so you won't miss our latest videos, where we're always by your side on the journey to a healthier and more meaningful life. Thank you for staying with us until the end of today's video. Soothing muscle pain and arthritis, supporting metabolism and natural anti-inflammation. For many seniors, the aches and pains felt in the morning upon waking or after light activity have become a familiar part of daily life. The quiet groans when stepping out of bed, the hesitation when standing up, the stiffness and lasting fatigue, all are signs of chronic inflammation quietly occurring inside the body. According to the Centers for Disease Control and Prevention, CDC, more than half of Americans over the age of 60 live with some form of arthritis. This condition not only makes movement difficult, but also affects mood, sleep quality, and the ability to care for oneself each day. One of the contributing factors to chronic inflammation is pH imbalance in the body. When the blood environment becomes more acidic than normal, inflammatory responses are more easily triggered, especially in muscle and joint tissues already weakened by age. This is where baking soda can play a helpful role. Baking soda sodium bicarbonate is a mildly alkaline substance that helps neutralize acid and maintain internal pH balance. A study published in 2018 by Augusta University in the Journal of Immunology found that daily consumption of low doses of baking soda dissolved in water can shift the immune system into an anti-inflammatory state. Specifically, the body increases M2 macrophages, anti-inflammatory cells, and reduces M1 macrophages, pro-inflammatory cells, the main drivers in chronic inflammation. Beyond that, baking soda also positively affects enzyme systems and muscle metabolism. When pH levels are stable, digestive enzymes, metabolic hormones, and muscle recovery processes function more efficiently. As a result, older adults may feel lighter and experience noticeable relief from stiffness and soreness. Another important benefit is its ability to reduce oxidative stress. Free radicals known to damage tissues and accelerate cellular aging become more active in acidic environments. By neutralizing this acidity, baking soda indirectly helps reduce the impact of oxidative stress on muscle and joint tissues. To make use of these benefits, here's how you can apply it. Dissolve 1/4 teaspoon of baking soda in approximately 120 milliliters of warm water. Drink it in the morning about 30 minutes before breakfast. Use 3 to 4 times per week. Do not take it daily without specific guidance from a doctor. However, important precautions should be noted. Do not use baking soda if you're on a low sodium diet, have uncontrolled high blood pressure, or have a history of kidney issues. Do not combine baking soda with non-steroidal anti-inflammatory drugs NSAIDs without consulting a doctor. Stop use if symptoms like nausea, dizziness, swelling in hands or feet, or unusual fatigue occur. Additionally, the benefits of baking soda are enhanced when combined with a healthy diet, especially anti-inflammatory foods like leafy greens, berries, omega-3 rich fish, and natural nuts. Maintaining light daily activities such as walking or gentle stretching also boosts its effectiveness in relieving pain and inflammation. A meta-analysis from the National Institutes of Health (NIH) also showed that using pH balancing methods like baking soda in combination with dietary and physical activity interventions may improve joint pain symptoms by up to 30% after 12 weeks. This shows the real potential of natural, safe, and easy to apply methods when used properly. Of course, baking soda is not the right solution for everyone. But if you're not in a restricted group and are looking for a gentle approach, this may be a path worth considering. Remember, no miracle happens overnight. But if you take time to listen to your body and stay consistent with even a small glass of water each day, you may start to feel the difference: a body with less pain, a smoother morning, and a more relaxed state of mind. In the next section, we'll explore another quiet but equally important benefit: how baking soda can help protect kidney function, especially in older adults whose kidneys are more vulnerable to damage. Supporting kidney function, a quiet solution for better body detoxification. Kidney function plays an essential role in maintaining overall health, especially in older adults. The kidneys not only filter blood and remove toxins, but also help maintain electrolyte balance, regulate blood pressure, and support hormonal activity. However, over time, kidney function tends to decline, a natural process that can happen more quickly without proper care. Many older adults begin to notice symptoms such as frequent nighttime urination, unexplained fatigue, loss of appetite, or mild swelling in the feet and ankles. These signs can be early indicators of declining kidney function. If not properly managed, this condition can lead to chronic kidney disease, a serious and difficult to treat health issue. One of the major factors that affect kidney performance is chronic mild acidosis in the body. This condition occurs when a modern diet, typically high in animal protein, refined sugars, and low in vegetables, causes the blood to become more acidic. In this acidic environment, the kidneys must work harder to eliminate excess acid, increasing the risk of damage. Baking soda, with its natural alkalizing properties, may help neutralize excess acid in the blood and ease the burden on the kidneys. A study published in the Journal of the American Society of Nephrology in 2009 found that patients with early-stage chronic kidney disease who were given low doses of sodium bicarbonate daily experienced a significantly slower decline in kidney function compared to those who did not receive it. The mechanism behind baking soda's effectiveness includes helping maintain stable blood. pH, reducing the release of vasoconstrictive hormones that damage glomeruli, limiting the formation of acidic metabolic byproducts, lowering filtration pressure in the glomeruli, prolonging kidney cell lifespan. How to use baking soda to support kidney function. Dissolve 1/3 teaspoon of baking soda in a cup of warm water, 150 milliliters. Drink it after a main meal, preferably lunch or dinner. Use 4 to 5 days per week, with 1 to 2 days off to observe how your body responds. However, baking soda should not replace medical treatments, especially for those already diagnosed with kidney disease. This method is meant to be a supportive supplement and should only be used by individuals with stable kidney function and no clear signs of damage. Medical precautions to keep in mind: individuals managing high blood pressure or following a low sodium diet should consult a doctor before use. Avoid taking baking soda at the same time as diuretics, potassium regulating drugs, or antacids. Discontinue use immediately if you experience symptoms such as bloating, prolonged nausea, or unusual changes in urine color. Additional healthy habits that help maintain kidney function include drinking enough water and avoiding prolonged dehydration, reducing salt and sugar intake, and limiting excess animal protein. Adding leafy greens and potassium-rich foods like bananas, sweet potatoes, and pumpkin, if not contraindicated, gentle physical activity to improve blood circulation to the kidneys. According to guidelines from the National Institute of Nutrition and documents from Mayo Clinic, older adults should have their kidney function checked at least once or twice a year, especially if they have a history of diabetes, high blood pressure, or kidney stones. When used properly, baking soda not only helps neutralize acidity, but also supports the kidney's filtration and excretion processes. As a result, it may bring a feeling of relief, reduce fatigue, and support deeper nighttime sleep by reducing the need to wake up frequently to urinate. In the next section, we'll explore another practical benefit, especially during cold weather or times when the body is feeling weak. Baking soda may help support the immune system and ease symptoms such as coughing, sore throat, or mild colds in a natural way. Supporting the immune system and relieving mild respiratory symptoms. A cold weather solution for seniors. As we age, the body's natural immune system gradually weakens. This makes older adults more susceptible to lingering minor illnesses such as colds, coughs, hoarseness, and sore throats. Especially during the winter months or seasonal transitions, these symptoms can lead to prolonged fatigue, sleep disturbances, and a reduced quality of life. One key factor in protecting the respiratory system is maintaining a stable internal pH. Research from the National Institutes of Health (NIH) shows that an acidic environment in the mouth and airways creates favorable conditions for bacteria and viruses to grow. In contrast, a mildly alkaline environment helps inhibit the development of pathogens. Baking soda, with its natural alkalizing properties, can be used as a gentle way to boost the immune system and reduce early respiratory symptoms. It can be applied in two main ways: by drinking a diluted solution or using it as a gargle. Benefits of baking soda for the immune system and respiratory health. Soothes mild irritation in the throat lining, reducing dryness and scratchiness, helps thin mucus and ease, mild productive coughs, inhibits bacterial growth in the mouth and throat. Gently cleanses the throat, especially when combined with salt water. Method 1. Drinking a diluted solution to support internal immunity. Mix 1/4 teaspoon of baking soda in a glass of warm water, about 120-150 milliliters. Sip slowly, swallowing gently to help cleanse the throat area. Best used in the morning or after exposure to cold environments. It can be taken once a day continuously for 3 to 5 days when feeling tired or experiencing a mild cold. Method 2. Gargling with a baking soda and salt solution. Mix 1/4 teaspoon of baking soda plus 1/4 teaspoon of pure salt in 200 milliliters of warm water. Gargle for 30 seconds, repeat 2 or 3 times. Use in the morning and again at bedtime, especially when your throat feels sore or there's mild mucus. Both methods can be paired with other supportive practices such as inhaling essential oil steam, e.g., peppermint or eucalyptus, keeping your throat warm when going outside, and drinking enough fluids throughout the day. Medical precautions: do not gargle with baking soda if you have a severe sore throat, acute tonsillitis, or a fever-related infection. Avoid swallowing the gargle solution, especially if you have digestive issues. Discontinue use if you experience allergic reactions. Prolonged throat itching or discomfort after use. To further enhance effectiveness, you should also follow an immune-boosting diet with foods such as garlic, turmeric, fresh ginger, dark leafy greens, and fruits rich in vitamin C. These help strengthen the immune system and support the recovery of respiratory tissues. According to Harvard Health Publishing, maintaining a stable immune system doesn't rely on a single factor. It's the result of many small daily habits working together. Baking soda is just one part of that, but when used properly, it can make a meaningful difference, helping you feel healthier, less fatigued, and better protected from mild respiratory conditions. In the next section, we'll explore the final but equally important benefit of baking soda, its role in improving sleep, reducing mild stress, and helping your body feel more relaxed and at ease each night. Deeper sleep, better mood. The art of listening to your body with a simple glass of water. Sleep is a vital foundation for both physical and mental health, especially in older adults. After turning 60, many people begin to experience difficulty falling asleep, frequent nighttime awakenings, or feeling tired even after a full night's sleep. According to a report from Harvard Medical School, sleep disorders are among the most common issues in seniors and directly affect the immune system, memory, concentration, and daily emotional well-being. There are several reasons behind sleep disturbances in older adults, including age-related hormonal changes and circadian rhythm shifts, chronic stress and underlying anxiety, declining digestive function causing bloating or nighttime acid reflux, imbalanced pH levels in the body leading to increased nerve stimulation. In this context, baking soda, a mildly alkaline substance, may help improve sleep by regulating the internal environment, supporting central nervous system relaxation, and enhancing the body's ability to enter natural sleep. Preliminary studies suggest that a mildly acidic internal environment increases the activity of stimulating receptors, making it harder for the brain to reach a relaxed state. Baking soda helps neutralize low-grade acid in the blood, reduces unnecessary nerve activity, and supports more stable neural metabolism during rest. Benefits of using baking soda before bedtime: reduces bloating and acid reflux, which often disrupts sleep, helps create a stable blood environment for easier nervous system relaxation, contributes to deeper sleep and fewer nighttime awakenings, supports gentle regulation of heart rate and blood pressure during rest. A simple method to support sleep: mix 1/4 teaspoon of baking soda into a glass of warm water, 120 ml. Drink about 45 minutes to 1 hour before going to bed. Use 2 to 3 times per week, especially on nights when the body feels heavy or restless. In addition to using baking soda, consider combining it with the following habits. Take a warm bath or soak your feet before bed to promote circulation. Avoid electronic devices for at least 30 minutes before bedtime. Create a quiet, cool, and dark sleep environment. Listen to soft music. Read a physical book, or practice light meditation to calm the mind. Medical precautions: do not use baking soda as a treatment for chronic insomnia. Avoid use if you have kidney issues, heart disease, or uncontrolled high blood pressure. If you experience symptoms such as headache, nausea, or prolonged insomnia after use, consult a doctor. Many older adults have shared that simply getting 1 to 2 hours of deeper sleep each night has made a huge difference in their daily energy, mood, and overall enjoyment of life. Baking soda is not a miracle cure, but when used properly, it can be a gentle bridge to more natural sleep. No medication, no anxiety. A healthy life journey starts with small things. As we grow older, what truly matters isn't just living longer, but living actively, healthily, and meaningfully. Caring for your health in your golden years doesn't have to be complicated. Sometimes just a warm glass of water with a small spoonful of baking soda used wisely can lead to positive changes for both body and mind. Always listen to your body, stick to healthy routines, and stay consistent with the little things that bring long-lasting results. Taking care of your health is not only a responsibility, it is also a daily act of self-love. If you found this content helpful, don't forget to share it with family or friends who are looking for natural ways to stay healthy. And make sure to subscribe to the Senior Health Table channel so you won't miss any of our latest videos, where we're always by your side on the journey to healthy, meaningful living. Thank you for staying with us until the end of today's video.